Hi, welcome to my YouTube channel. This is Wellbeing Data and Sound Lifestyle. I am your host Kingemi. In the present video, we are going to discuss heart attack, meaning 10 significant causes and 5 important estimates you should take while encountering coronary failure. Before we proceed, if you like this video, please offer us a go ahead and buy into our channel so it would empower you to receive warning at whatever point we drop another useful recordings like this. Minus any additional ado, let's leap directly in. A coronary episode is known as a myocardial dead tissue. This happens when the heart muscle is harmed or doesn't get sufficient oxygen. Numerous cardiovascular related issues happen because of blockages in veins that divert cleansed blood from the heart to various pieces of the body. Another reason is the arrangement of blood clusters. All the time, it is very hard to separate between a coronary failure and heartburn. Call 911 or crisis clinical assistance in the event that you figure you may be having a cardiovascular failure. Somebody having a coronary failure may have any or the entirety of the accompanying chest agony, pressing factor or snugness, or a crushing or throbbing sensation in the focal point of the chest. Torment or uneasiness that spreads to the shoulder, arm, back, neck, jaw, teeth or incidentally upper midsection. Queasiness, acid reflux, indigestion or stomach torment. Windedness. Unsteadiness, tipsiness, swooning. Perspiring. A cardiovascular failure for the most part causes chest torment for over 15 minutes. A few group have gentle chest torment, while others have more extreme agony. The distress is generally depicted as a pressing factor or chest substantialness, albeit a few group have no chest agony or pressing factor by any means. Ladies will in general have more unclear manifestations, like queasiness or back or jaw torment. Some coronary failures strike unexpectedly, yet numerous individuals have cautioning signs hours or days ahead of time. What to do in the event that you or another person might be having a coronary episode? Call 911 or your neighborhood crisis number. Don't overlook the indications of a respiratory failure. In the event that you can't get an emergency vehicle or crisis vehicle to come to you, have a neighbor or a companion drive you to the closest clinic. Drive yourself just in the event that you have no other choice. Since your condition can deteriorate, driving yourself puts you and others in danger. Bite and swallow an aspirin while hanging tight for crisis help. Headache medicine helps hold your blood back from coagulating. When taken during a coronary episode, it could decrease heart harm. Try not to take ibuprofen in the event that you are sensitive to it or have been advised by your PCP never to take anti-inflammatory medicine. Take nitroglycerin, if endorsed. On the off chance that you believe you're having a cardiovascular failure and your primary care physician has recently endorsed dynamite for you, accept it as coordinated while sitting tight for crisis clinical assistance. Begin CPR if the individual is unconscious. If the individual isn't breathing or you don't discover a heartbeat, begin CPR to keep blood streaming after you call for crisis clinical assistance. Push rigid on the focal point of the individual's chest in a genuinely fast musicality, around 100 to 120 compressions every moment. In the event that a mechanized outer defibrillator aid is quickly accessible and the individual is oblivious, adhere to the gadget guidelines for utilizing it. The hazard factors for a coronary episode include smoking, diabetes, significant degrees of cholesterol, hypertension, family background of heart illnesses, atherosclerosis, absence of activity, heftiness, and quick food varieties. Diminish the dangers of a cardiovascular failure by 1. Stopping smoking. 2. Practicing good eating habits. Stay away from greasy food source. 3. Controlling hypertension and diabetes. 4. Guaranteeing normal exercise somewhere around 30 minutes per day. Strolling is generally valuable. 5. Forestalling heftiness. Doing everything you can to keep up with weight. 6. Deciding to carry on with a solid way of life. 7. Rehearsing reflection. 8. Doing standard unwinding and breathing activities. 9. Going through occasional cardiovascular assessments. 10. Counting food varieties that are wealthy in enemies of oxidants in your eating regimen. A stellar sickness. As per the American Heart Association, roughly 58.8 million individuals in the US experience the ill effects of heart infections. What's more, around 950,000 Americans pass on of heart diseases every year. Heart illnesses and passing from it tends to be forestalled by keeping up with your well-being. Discover an equilibrium in life among work and different exercises. Leave the sofa for the outside. Don't watch sports on TV. Play sports. All things considered, and you can want to carry on with a long and satisfied life. Much thanks to you for watching.